Hi guys, my name is Amy. Welcome to my channel. If you are new here, thank you so much for joining us today. And if you're not new here, thank you so much for coming back. I really do appreciate it. So today's video is going to be, as you noticed by the title, about motherhood and mental health. I was gonna rehearse it and write it out and do like a whole format thing. And then I just kind of decided I'm gonna wing it. I'm gonna share my story. And if it comes out choppy or disheveled or confusing, I apologize. But it is what it is. So if you want to hear my story and my battles with anxiety and panic attacks and just fear in general, as it pertains to kind of like my overall struggle, but really just with this last pregnancy and then postpartum period, then this video is for you. Okay, so to start out, I have had anxiety, like postpartum anxiety, with 2 out of my 4 previous pregnancies. I was on medication for both of those, and I think a lot of the anxiety symptoms could have been related to like thyroid issues, because a lot of times, like if you're pregnant, you can go, or after you give birth, you can go like, it's called postpartum thyroiditis. And like you can go super hyperthyroid, and then you can like kind of level out and go a little hypo, and then before everything balances. It varies from person to person, but definitely with at least my first 3 pregnancies, I had postpartum thyroiditis. My thyroid went super hyper and I like lost ridiculous amounts of weight. And I mean, I ate literally everything I saw and I couldn't keep on weight. It was ridiculous. I think after Jacob was born, around the 7-month mark, was really losing weight. And like I had to buy my jeans down to like a size 4. And then like seriously, 3 to 4 weeks later, I had to buy a size 2. It was ridiculous. It was insane. I actually was looking at pictures of his first birthday and I was like, good Lord, a little skeleton person sitting there in my clothes. It was crazy. Off to a great start. My battery died. Now I can't remember where I left off, but I think I was talking about after Jacob was born, my thyroid kind of going crazy. After Lily was born, I didn't seem to have the same hyperthyroid issue. I did have a lot of anxiety, and but I think that was different. It wasn't as early onset, and I think it could have partially been my thyroid. But basically, I mean, I waited till probably she was about 6 months old or so before going and talking to my OB, or my regular doctor rather, about getting on meds for anxiety and depression. And so I took Zoloft for I think 8 months. I stopped taking it when she was about 15 months old, I think, because that's when we decided we were going to have another baby. And so we wanted to start trying, and I felt pretty good. And I had success previously just with a short dose or short stint of medications. And so I weaned off of it and it was fine. I did notice that I would have anxiety, like for me previously, like my anxiety would be like if I got overtired or if I was overstimulated, like I just felt like twitchy and jittery, and like I was just like, I'm done, I need to go to sleep. I had like restless leg type stuff, and so it wasn't terrible, but it was more elevated than what I would call normal. So anyway, that was prior to getting pregnant. Now this time, in order to conceive Henry, we tried for 6 months. Things were not happening. And normally, unless you're over 35, they tell you to try for a year. I was going to be 35 in December. And so in June, I went in and I convinced the doctor, you need to check. Something's not right. We've never had trouble getting pregnant before. Tim had gone in and he had some issues with like low testosterone. And so I was like, well, we need to just do basic labs for him and for me to make sure that everything is working properly. And it was. And so we continued to try. We did a couple of medicated cycles with Clomid to try and induce ovulation in case that was the problem. Those failed. We did, I think, 4 of those. move on to a year later, we tried IUI. That didn't work. And so we'd been trying for a year and a half and the IUIs failed. We moved across the country. And we began to look into IVF because on paper there was no reason. So we had secondary unexplained infertility, which I've done a video on, and it sucks and it's awful. And the emotions that go with it are awful. And so I think just a little bit of anxiety and stress in that situation would be normal. And then we moved on. We finally did IVF. I got pregnant. And then I was nervous that it wasn't going to take. Like, what if this doesn't work? If this doesn't work, what are we going to do? And then I was pregnant. And then I was waiting for the whole first 12 weeks for something to happen. Like, am I going to lose this baby? Is this going to be, you know, more heartbreak on top of the heartbreak of trying to get pregnant and being unable to? And so there was a lot of worry and I feel like just tension. And I almost feel like I got into... like I trained myself to be anxious, if that makes sense. I was so anxious all the time that when I wasn't feeling anxious, I would notice that I wasn't anxious and then I'd be like, what's going on? Obviously, the pregnancy progressed normally. I was healthy. Everything was fine. This is where things start to get really frustrating and just hard for me. And this is kind of... I'm hoping that maybe if I share, it will help somebody. So... when I was 20 weeks pregnant, I went in to have my anatomy scan and everything was perfect. Everything was fine. Baby's fine. We'd already done the maternity 21 testing, which is just, they do a blood draw for me and it can test for, it tests for the main like trisomy 21, 18, and 13. I feel like I might be mucking that up. Anyway, it tests for chromosomal abnormalities and things like that. They can tell the gender. They can tell a lot of things from that blood test. And so we did that. And everything, again, was perfect. Everything was fine. The baby was healthy. There was nothing wrong. I had no reason to worry. Everything was fine. I was healthy, progressing, again, perfectly normally. So we did the anatomy scan and then we moved. So we had moved prior to 20 weeks, but I still had insurance in North Carolina. I still had my doctor in North Carolina and I already had the appointment scheduled. So we went ahead and did the anatomy scan and the follow-up visit. And then when 24 weeks came around, I had made an appointment with a new OBGYN in the town that we live in now, which is a considerably smaller town and it's outside of main metropolis areas. I mean, it's still technically kind of the Charlotte metro area, but it's not like super close. Anyway, I made an appointment at 24 weeks and I was like, okay, well, we'll go in. I ended up sitting in the lobby for 2 hours waiting to see the doctor. I didn't even get to see the doctor. I saw a nurse. She took all my basic health information and it was kind of like an intake appointment. I briefly saw the doctor for a second and they were like, okay, we'll get your records sent over, come back at 28 weeks and we'll do your 28-week appointment. You have to get a DTaP booster. I told them I was already current, but they were like, well, no, you still have to get it, which I didn't want to do. He was like, we'll do a pelvic exam. And I said, there's no reason to. I've already had a pelvic exam this pregnancy. Everything's fine. I'll have my medical records sent over. And they were like, no, we need to do it anyway. And the doctor just like, I didn't get a good vibe from him. Like we didn't connect. He wasn't, his personality was just not something that made me feel comfortable and at ease. And then being told that I had to do a pelvic exam when I'd already had one and it was not medically necessary. It all kind of set me on edge. Like I have background and history with various things, abuse and assault and things like that. And so I was like, no, I'm saying no, I don't want to. And it set off my anxiety. The thought of going back to this obstetrician set off my anxiety. Like I was so anxious about it. I'm like, I don't want to go back. I don't want to have to fight with them and tell them no, but then what if I drop my care? And like, I didn't want to make a scene. I didn't want to confront them. I didn't want to have an argument, but I didn't want to go back and just do what they wanted me to do. So I didn't go. Apparently, when you leave care of one doctor while you were pregnant, the proper appropriate channels are to transfer care to a new doctor through your doctor. So have your doctor say, hey, I'm going to this new doctor. I need you to get the records here. You don't find care on your own. That's not a thing that you do. So that's what I did. I didn't know. So at 28 weeks, I didn't go into my appointment. Around the 30-week mark, I started feeling a a little anxious, and like maybe I needed to talk with somebody about anxiety treatments. I'd had anxiety for a lot of the pregnancy, just surrounding many things, even though I knew the baby was perfectly healthy. I knew that I was okay. Just, it felt like, what if we worked so hard to get here, and then what if something happens now? What if something happens to the baby and we lose him? What if there's a complication that shouldn't have happened but did during my delivery? Like, there was just so many what ifs, and my anxiety started to take off. So I tried to get help. I called doctors, and because I was past 28 weeks pregnant and I hadn't seen anybody since the 20-week mark, technically, it had been 10 weeks. And so they told me that there was too long between my care. They didn't take new patients from 28 weeks on, and so I had to have been transferred from an OB, but because I didn't have established care any longer with an OB, I could not be a transfer patient. So I was basically told you can't have health care. I explained to them I'm having horrible anxiety. I started having panic attacks, which was a new thing for me, but they were terrifying. I thought I was dying. I literally would lay there thinking, I'm gonna die. I'm dying right now. I'm going to die. I'm not going to live through this. And then I would think, well, what do we do? I mean, maybe if he calls an ambulance fast enough, my husband can get somebody here to get me to the hospital and keep me alive long enough to get the baby out so that the baby's okay. Like, I mean, these are the thoughts that were going through my head. It was awful. But I was told that since I didn't have that, oh, I'm really sorry that you're having these problems. I hope you find care. I hope you find help. I hope that works out for you. Because that's how we treat mental health. Oh, I mean, yeah, you're sad, you're anxious, you're a little scared. Like, it's not taken seriously by so many people. So there I was at that point, 32 weeks pregnant, horrible anxiety, panic attacks. I had no options for care. We were right at the beginning of the isolation and pandemic stuff. It was like, I literally was told, well, if you want an OBGYN, the only way to get seen by one, the only way to get in front of one, your best chance at getting taken on for care is to go to the emergency room and get transferred to labor and delivery and to get a doctor that way. So basically, go in with an acute complaint, because I had anxiety, I wasn't sure that if I walked in and said I'm having anxiety, that they would take that as an acute complaint and actually admit me and put me in front of an OB anyway. My anxiety was so bad at that point that I was afraid they were going to give me something for the anxiety and that it would not work, that it would make me more anxious, because I have a bad reaction to Relearn, which is a medication commonly used for migraines. I have a bad reaction to it. It makes my anxiety worse. It gives me panic attacks. It makes me think that I'm dying. It's a known side effect, but I've always been treated like, oh, you just want the narcotics, so we're going to give you this anyway. And I've tried it multiple times. I've tried thinking maybe it was just the circumstances. I've tried every suggestion, and every time it has made me feel so much worse, and you have to wait for it to get out of your system. So then I was having anxiety. What if they give me, something to calm me down and it makes it worse? Like, then I just have to ride that out. How am I going to ride that out? So it was so multifaceted. And then I got to 35 weeks and we went to a women's retreat at church. We came back from the retreat that weekend. We celebrated Purim on Monday, and by Friday, everything was locked down. Everything was shut down. People were staying home. They were advising people not to leave their houses, to socially distance. All that stuff had started. So then I was told, okay, well, when you go into labor, I was like, what am I supposed to do? What do I do exactly? Like, I was calling offices and OBs and talking to office managers and asking, well, what do I do? And they said, well, go into the emergency room. The thought of going into an emergency room in a pandemic to get admitted to labor and delivery, to give birth to my baby, where they may not even let Tim come in. And then what do I do with my children? Because my children can't come, because at that time it was one visitor only, which could have been my husband, unless he stayed home with the kids, so they weren't scared. And my friend took me, but that visitor was the only one allowed. Once that person went in with you, they were the only person allowed to see you until you were discharged. And it was awful. So we decided to have the baby at home. I was at peace much more. I had controlled my panic attacks and anxiety. I stopped taking my thyroid med because I believe I was over medicated, and once that leveled out, my anxiety was much better. I still was having some issues, but it was much better. So we decided to have the baby at home. I've had 2 home births. I felt confident that we were safe in doing that, and also we're real close to the fire station. If we needed emergency medical services, we're real close to the hospital. So I felt like that was the best option. So we had the baby at home. And then I had the baby, and I went to my regular doctor and I said, had a baby 4 days ago. I need to establish care with you. I need to get on anti-anxiety meds. I had postpartum anxiety. I've had issues with anxiety. I just want to start the meds now. She asked about my birth, and she asked about my OBGYN and why I didn't talk to them and all this and that. And I explained what had happened. And I was basically treated like it was all my fault. Oh, well, you should have done this. You should have done it this way. You're supposed to do it this way. You didn't do it this way, so you didn't get continuous care. And it was basically like, well, that's your fault. And then my doctor was like, well, you can't take medication because you're nursing. I was treated like it was wrong, like, you know, because I didn't do it the way that I was supposed to, even though I said I didn't know that I had to do it that way. I didn't know that I wasn't allowed to find an OB on my own. I didn't know that I wouldn't be able to get care. And, you know, well, why'd you just stop taking your thyroid meds? Well, I didn't have another option. I have a doctor that would see me. Nobody would see me and treat me while I was pregnant because it was a regular doctor. They didn't see pregnant patients. You needed to see an OB. And if it was an OB, they don't see you because you're too far along and we haven't established care. Like, I was treated basically like it was all my fault and this is what I should have expected. And I tried to explain, you know, I had anxiety about going back and just the nature of it. Anyway, I was then told by the same doctor, oh, well, you haven't, you're breastfeeding, so I can't give you any rescue meds for anxiety. You're breastfeeding, I can't give you any rescue meds for migraines. I can't give you any preventative meds for migraines. She told me to take Tylenol for my migraines. And because I hadn't seen an OBGYN, I needed to go see an OBGYN to make sure that my high blood pressure and headaches weren't caused by retained placenta or some other complication. But I didn't get an appointment until 5 weeks postpartum. It was all just very ridiculous. It's like the doctor had no knowledge of pregnancy and birthing and things like that. And then on top of that, she was punishing me for not going through the medical system. She also drew blood to test my thyroid as I asked her, but she also ordered a lipid panel, which I did not know. So they tested my cholesterol, which was elevated. And she called me and told me that I was at extreme risk for heart attack, that I couldn't take anything to lower my cholesterol while I was breastfeeding. And so I would just have to take baby aspirin to give me the best option of preventative measures as possible. But a quick Google search will tell you that high cholesterol, elevated cholesterol, and elevated lipid panel is normal during the last weeks of pregnancy. It's normal postpartum until about 6 weeks. They don't level out. So basically, my doctor was scaring the crap out of me and giving me more anxiety that I was going to die based on information that wasn't even accurate. So here we are. I am 5 weeks postpartum, 4.5 weeks postpartum, 5 weeks postpartum now. I did see an OBGYN. I did go to that appointment just a couple days ago. That actually ended better than any other appointment I have made with a medical doctor recently. He was totally okay with the fact that we had the baby at home. He did explain, you know, obviously they don't endorse that or say, let's do that, because if there is a risk, then you can't get intervention, which I understand. He's coming from a medical standpoint, it's fine. But he was not judgmental. He wasn't critical of me. He wasn't basically punishing me for the choices that I made based on the way that I was treated and the information that I was given and the fact that I had anxiety. I had this mental illness that was crippling me. I started therapy. I started therapy 3 weeks ago, I think. That's been fantastic. My therapist has been helping me to deal with panic attacks, to find the root of my panic attacks, to find the root of my anxiety, to find coping mechanisms, to deal with my anxiety until I can get back into a way of living where I'm not living every day struggling. Because I was struggling. Every single day I would wake up and I'd spend the day thinking, okay, what's going to make me anxious today? Okay, remember, if you get anxious, you have to talk yourself down. Okay, it's not working. You're not dying. But what if I do die? What if I take a nap to feel better and I don't wake up? Except for that my anxiety was probably caused because I didn't sleep well the night before, and that can make you anxious and feel just, you know, you need sleep. Sleep is good for mental health. But I was afraid if I went to sleep, I would die in my sleep. I was afraid if I didn't go to sleep that I was going crazy. I constantly thought, well, what if I'm having a heart attack? What if that pain in my lower right side is because I have an infection because of retained placenta? What if my blood pressure is so high that I'm going to have a stroke? What if something bad happens to my baby? What if this is the last time I see? Like, these are thoughts that were going through my head constantly, all the time, all day long. And I couldn't get anybody to help me. I feel like there's such a breakdown, first of all, in our medical system. Like, it's so wrong. But second of all, these are not things that you have to cope with. Like, you can get help. You can get medication if you need it. I tried Zoloft this time around just to start out. My OB did end up prescribing me a very low dose of Zoloft, and it actually ended up making it worse. I think I had what was called activation syndrome, which can happen. I mean, I've had more babies since then. Took all the hormones for IVF. My body has changed since the last time I took it. But with activation syndrome, it can actually make your anxiety and panic attacks worse. And I sent a message to my doctor and I asked her, is this something that will go away? If I tough it out for a few days, will it go away? You know, like the other symptoms when you start taking SSRIs, they kind of, side effects go away. And so I asked her, will this go away or do I have to stop the medication for it to go away? And she simply responded and told me, if you want to wean off the medication or if you want to stop the medication, you have to wean off. Here's how. She didn't address my concerns about the side effects. She didn't answer my question whatsoever. She just basically told me how to get off the med. So needless to say, I'll be looking for a new doctor. But these things are, I mean, they're not abnormal. It doesn't make you wrong or weird or bad or broken to feel these things, especially not after giving birth. Your body goes through so much and there's so many hormonal fluctuations, and it's not just baby blues. It's not just, oh, I'm sad, oh, I'm tired, oh, I need to sleep. It's okay. It's okay to ask for help. It's okay to say, I'm scared. I've told my husband, I'm scared. I just want to love my baby and hold my baby and snuggle my baby. And instead I'm sitting here worrying about dying or whatever. Like, I have cried about it. I have told him I think I'm having a heart attack and he's had to talk me down. It's okay to say these things out loud, and it's okay to admit that crap's not okay. Like, I think that it's so hard because when people say, oh my gosh, I'm having anxiety or I was so anxious, it's not the same thing as having actual anxiety, like an anxiety disorder. It's not, oh, I feel so tired and like I just can't think straight and oh man, I'm having a rough day. Every single day was rough. It's getting better now, but I still have days where I'm like, well, what's going on? How long am I going to feel like this? Is this going to last? Am I going to feel okay today and tomorrow? Or is it just for today? Or like, I still get anxious, but I'm working on it. That's just kind of a rundown of my story. My struggle through anxiety and panic attacks, and my struggle to get care and to feel heard. And I just hope that if you're watching this video, if it is something that you're going through, if you think you might have anxiety or depression or panic attacks or panic disorder or just anything, be it prenatal, postnatal, postpartum, just in general, maybe you don't even have children, maybe you've never been pregnant, maybe you're not even a girl, I don't know. If you're struggling with that, it's okay. It's okay, and it's okay to fight for yourself. It's okay to say, no, this isn't right. I want to find an option that works for me. I want to find treatment. I want to feel good. I want to feel better. It's not selfish and it's not strange to want to be happy, to want to live your life normally. And so if that's you, if you're struggling and you're struggling to get care, just please keep trying. Please keep trying, and please know that I hear you. I believe you. I see you for the person that you are, and not just your struggles, but I also see that anxiety and depression and panic attacks, they can be debilitating, crippling. They take your life from you. And if nobody else is listening right now, I will listen. I will listen until you find somebody that will listen to you. And just please know that there's hope. My OB, even though he didn't prescribe me any meds or tell me what to do, or just him validating my choice and telling me that I wasn't insane or stupid or crazy or risking my baby's life, and just listening to me and listening to why I made the choices I made, that made the difference. My therapist listening to me and telling me, you know what, it doesn't sound like your doctor was knowledgeable, you're not crazy, made the difference. My husband telling me it's okay, we're going to get through this. It all made the difference. Sharing what I was going through and letting people tell me it's going to be okay, we'll figure this out, made a difference. So please, just if you're struggling, reach out. Know that there are people that will listen. I will listen. And I just want to say thanks for joining me today for this video. Sorry if it was a downer. I really hope it helps somebody. And I will see you back here soon.